Hi, I'm Elazer Edelman. I'm a professor at MIT and actually at Harvard Medical School. I'm a practicing clinician and a biomedical engineer. Our research leverages basic findings in biology, applied physiology, engineering, and fundamental sciences to rapidly translate ideas from conception to clinical introduction, from the formation of an idea to its introduction into the community. I get to work with the best students in the world, and I have been privileged to lead a number of centers at MIT, the Harvard-MIT Biomedical Engineering Center and MIT's Clinical Research Center. And from those vantage points, we're able to use a specific paradigm as to how to engage in what we call translational research. And this means not only being multidisciplinary, that is fluent in very, very many disciplines, but also by engaging people from those very many different disciplines at once. We deal not only with the best in academia, the best in academic sciences, but the best in industry, the best in industrial sciences. And we bring people together not only who speak one language, but who speak multiple languages so that we can create new therapeutics, new diagnostics, new means of understanding diseases that are combinations of very many disciplines. ILP and industry are a very important component of our center research, of the research of the individual laboratories in the center and the individual people in the center. The ability to reach out to leading scientists in industry and to use industry as a means of realizing the full potential of our ideas is essential to what we do. There are wonderful examples of how this multi-fluency paradigm, how this idea of bringing people together from multiple disciplines, how engaging academic scientists and industrial science has transformed the practice of medicine and changed the quality of people's lives around the world. The examples we're most proud of are our work on endovascular stents, on stents that are inserted into people's coronary arteries. These metal mesh tubes are devices that now can be threaded up from an artery in the periphery, in an arm or a leg, into your heart to relieve an obstruction. And whereas before we had to make critical decisions, suffer with your disease or undergo an extremely challenging and demanding open chest surgery. Today, we can relieve that obstruction within a matter of minutes through the insertion of these tubes. There's hardly a person in the world today who doesn't know about these stents, but very few people understand that most of the modern designs emanated in part from work done in our research centers. And virtually all of those that are FDA approved for clinical use in the United States at one point passed through MIT laboratories.